Hello, everyone. My name is Werner. I'm a nurse practitioner at Mayo Clinic Arizona, and I have been working there for over 20 years. So I have these questions from the community GI with regards to fibrosis and MASLD as well as MASH. The most common questions I get is that what happens if I'm diagnosed with MASLD and I have no other physical complaints? I'm just incidentally noted to have fatty liver on my ultrasound. And a lot of times patients will have all these questions about what to do. And are they in trouble or they're going to have liver disease in the future? And so the main thing is that we talk to patients and tell them really it's a combination of everything. We look at the patient's age, comorbidities, as well as their lifestyle. And so these three things we combine with their laboratory tests, their findings. And really, if it's plain MASLD, which is benign, and there's no elevated liver function test, first thing we tell them is to work on lifestyle modification with diet and exercise, and also making sure that they do their best to monitor their diet, working on at least 5 to 10% weight loss, and then follow up with their primary care. On the other hand, in patients with comorbidities, patients who are obese or have metabolic risk factors such as hypertension, hyperlipidemia, especially diabetes, we want to make sure that in addition to lifestyle modification with diet and exercise, that they optimize their management for hypertension, they optimize their management for hyperlipidemia, and as well as the optimized management of diabetes. And in that way, they have these parameters on what they need to do in order to continue healthy living. I usually encourage patients to work with their friends, their community network, because I always think that willpower is not as powerful than company. So including friends and company and making sure that they have a partner in this journey. And I think it's more successful doing that, especially with their goal of healthy lifestyle. The second question I get a lot is that what if they have fibrosis that is advanced? And but they don't have any signs of cirrhosis in this category of compensated cirrhosis. And a lot of times our advice is to continue monitoring, continue follow up with hepatology, making sure that their liver numbers are good and making sure that they're still working, they're continuing working on lifestyle modification, the diet and exercise, and optimizing their management of their metabolic issues, health issues. And then we emphasize the importance of surveillance, such as ultrasound or CT scan, or alternate with MRI every 6 months to check for hepatocellular carcinoma, to screen them, and also making sure that they undergo surveillance for esophageal varices screening. And a lot of times patients do well over time as long as they keep themselves healthy and staying away from any hepatotoxic medications. Close follow-up is very important, especially if there's any signs or symptoms or maybe development of ascites or confusion and all that. So it's really important to educate the patient and their family when they do have this diagnosis of cirrhosis from MASH or MASLD. Thank you for listening, and please contact us at the MASLD MASH Community Network for any questions.